Hi, welcome back. My name is Martha Gordon. I am an outpatient clinical therapist for Syntero Counseling. This is the second video in a series of 3 discussing how mental health is related to workplace retention. This series of presentations comes to you through a collaboration of Goodwill Columbus, Syntero Counseling, and Southside Thrive. Again, I said this is a 3-part series. The first part discussed why mental health is an important lens to use in looking at retention and attrition in the workplace. The second video, this one is going to discuss what a mentally healthy workplace looks like. And the third video in the series will discuss more specifics about how a company can implement that change. So what is a mentally healthy workplace? In a mentally healthy workplace, if you're using a mental health lens to think about your employees, we want to recognize that the employees that walk in the door come in with baggage. They come in with experiences and a worldview that influences how they do their work when they're in the workplace. When they come from a traumatic or chaotic background, it's more difficult for them to engage in the workplace. We want to recognize people who have had those experiences and how it influences them. And we want to respond to that need by being more intentional in the way we create the workplace and the way we interact with folks in the workplace. So today we're going to talk about what that looks like. Specifically, I want to outline the principles of a mentally healthy approach to employees, describe what a mentally healthy culture looks like, and give examples of an inclusive culture, mentally healthy culture. What are the barriers to retention? Well, just to review, when people are exposed to trauma early on in their lives, they have increased vulnerability to a number of other things. They have increased vulnerability to physical and psychological health problems, interpersonal problems. They have environmental problems like poverty and homelessness, and they are more likely to be exposed to and contract illnesses like COVID. Why do they leave? Well, they leave because they tend to be more suspicious and less trusting. They resist authority and discipline. They sometimes don't work well in teams, creating problems of insubordination. And they tend to have more trouble with interpersonal encounters, leading them to practice avoidance, to just not show up when things are difficult. So COVID-19 is something that has impacted everybody in the world. And in Franklin County, as of January 12th, there were over 93,000 cases of COVID and over 700 deaths. When we're thinking about our entry-level workforce, this is a vulnerable workforce. It's already compromised by early life events and by the stresses of just trying to exist. When you add in the stresses of the pandemic on top of that, and you talk about people's losses, people's illnesses, managing school from home, transportation issues, the stress of not knowing if when I go to work I'm going to be exposed, all of those things are contributing to additional retention problems. There has been documentation of increased problems specifically due to COVID in the entry-level workforce, including increased substance use, increased domestic violence, problems eating and sleeping, and an increase in health complaints. The number of people reporting symptoms of anxiety and depression during COVID are on the rise. They're significantly higher than they have been in the past and continue to go up as people are sitting with the ambiguity of whether or not their loved ones are going to be sick. And if they do become sick, how long it's going to take them to recover, if at all. In addition to that, a number of people are aware that stresses related to COVID have had a significant negative impact on their mental health. So people who were in pretty good health in the first place are feeling stressed, but people who were already in a compromised state in terms of their physical and mental health are experiencing a much greater contribution to COVID. So that vulnerability is working against them. When people are stressed, when people are feeling overwhelmed, this is the kind of thing that's going on in their head. I feel hopeless. I feel worthless. I'm boring. I'm sickening. I'm broken. I'm unwanted. So what do we want to do in the workplace? We want to create a mentally healthy workplace by including these particular characteristics in our workplace. We want to include a sense of physical as well as psychological safety, a sense of trustworthiness and transparency. We want to emphasize peer support, collaboration, and mutuality. We want to give people a voice, and we want to recognize differences. So what is psychological safety? When I don't feel safe, I'm not going to be able to put my full attention at work. When I don't feel safe at work, I'm less likely to actually go to work. And when I'm there, I'm not going to be able to give all of my attention to work. So I'm hypervigilant, I'm distracted, I may be more likely to call off because it is such a difficult activity for me to physically go into a place where I don't feel safe. So what we want to do is we want to come up with ways to identify physical and psychological factors that we can control to reassure an employee. In terms of psychological safety, if somebody cares about their work and they're willing to invest themselves in it, they're better able to recognize and address those elements that are causing them distress in a professional and business-like way, that radical candor. When people don't care or are so compromised that they don't feel able to speak, we get these other behaviors, and these behaviors, ruinous empathy, manipulative insincerity, and obnoxious aggression, contribute to insubordination and to dismissal, or encourage the client or the employee to feel that they are not heard and for them to leave or quit. We want to create an environment of trust and transparency so people feel able to discuss their concerns. When employees have had experiences of not being heard, of chaos and ambiguity in their lives, and when they have no sense of control over what's going on, they are often suspicious and untrusting. That leads to incidents of insubordination and extreme overreaction to constructive criticism, policy changes, redirection, reteaching. One of the solutions could be different kinds of training modalities, frequent training refreshers, and compassionate corrections, and also to peer support. So people that grow up in a chaotic place, people who are not feeling safe at anywhere in their lives, are less likely to trust others, because trusting others may have additionally compromised their sense of security in the past. So we tend to have people who are lone wolves, people who prefer isolation, people who say, I don't like people, and I don't like to be in a group, and I don't work well with others. So we have people that are not good team players, or who appear to be unsubordinate or uncooperative. Teaching and training that through modeling and having a system of peer support and engagement can be one way to offset that problem. We want to create an environment where people feel that their voices can be heard and they are part of the decision-making process. Many folks who have experienced trauma find themselves to be feel that they're overlooked, that their points of view and their needs are not recognized, leading them to a lot of in-group, out-group behavior, blaming others, being secretive about problems. Open communication and different modalities of communication among levels of employees in the company can reduce some of this, can increase collaboration and mutuality. So again, we want to be heard. Everyone wants to be heard. Employees who have a history of trauma frequently have not been heard and then tend no longer to speak out. They become very defensive and less likely to voice their concerns, more likely to nurture their grievances and grudges quietly, leading them to feel unwelcome, unwanted, and to leave their employment. They get bored, they skip steps, they don't understand or don't want to follow procedures or protocols because they don't understand them, because they haven't had a part in creating them. So including different levels of employees in decision-making and policy-making is a way to offset that. So there are a lot of different cultures and subcultures that make up employee bases, recognizing their cultural, historical, and gender issues that people walk in with that may be at the core of some of their traumatic experiences, and giving opportunities to voice those in appropriate ways in the workplace can reduce the sense of exclusion that often takes place in a workplace when you have different groups of people working together. So fostering team building is a meaningful and cost-effective expense for a company. There is a great deal of literature and background information about employee engagement, and it is not a new idea. I ran across this article with a picture from the 1920s showing the Buckeye Steel Castings employees who were offered. It says, during the early 1900s, companies' management started programs and services in an effort to retain workers, including the addition of washrooms, lockers, kitchen, cafeteria, hospital. The company sponsored basketball, bowling, volleyball, and baseball teams, in addition to bands and orchestras. So the idea of extracurricular things for employees to connect to that are sponsored by and encouraged by the company is not a new phenomenon. So we want to create a mentally healthy workplace that includes these characteristics of safety, transparency, support and collaboration, empowerment, and recognizes different groups as equal and meaningful to the workplace. It will result, hopefully, in a collaborative team that is very successful and productive. The next video is going to touch on and give more examples of what this looks like, how you can actually do this, what some companies are doing to create this kind of mentally healthy workplace. We're going to talk about how a mentally healthy workplace evolves, some examples, and what you can do to build that in your own workplace. Thank you very much.